I think one of the foremost is the CBCT, or the cone beam computer tomography dental radiograph. So long story short, it's a 3D x-ray. So for years and years, we've had small little two-dimensional x-rays, which are great, but they only give us 2 dimensions. And when you're looking at a 3-dimensional situation, having a 3-dimensional x-ray lets us know height, width, depth, and it lets us plan for a lot more and see a lot more than we previously could. Helps us be a lot more minimally invasive. One of my favorite tools to use in the office is the intraoral scanner. This is a wireless small camera that we use to take hundreds of photographs of our guest's mouth, and it renders a 3-dimensional image that we can manipulate in the digital space, which is wonderful because the patient doesn't have to worry about all that goopy impression material. Unless you really love that, we could probably pull some out of the back, but it's a great way for us to capture data and visualize that and plan accordingly to that. So it's really neat technology. So I want to address what most patients feel is the scariest instrument that we have in the dental office, and that's this guy, the camera. The reason for that is because the camera doesn't lie. So if people come in with some dental insecurities and we're using photos, sometimes people are intimidated, but we use this for a very important reason. People often say that a picture's worth 1,000 words, and that's very true. For us to communicate with some of the other technicians and specialists and some of the ceramic artists, we need to capture that information with our planning and our execution to give you a smile that's amazing. Sometimes we'll even use things like polarized lenses to make sure that we're capturing the right value and hue and chroma of teeth and their relations, so we can get you something that looks natural and really aesthetic. In order to maximize the technology and to minimize the time you need to spend in our office, we will take that 3-dimensional radiograph that we take and the 3-dimensional or intraoral scan of the photos that we take, and we'll overlay them on top of each other. When we do that, we can see how the imaging takes place on the x-rays, and we can even take your photos and overlay that as well. So we can have all this data and all this information to plan where the teeth go in the face, where implants need to go, how we're going to support the jawbone, the soft tissues, and we can plan the whole thing out from a digital perspective. It's pretty amazing. Using all of this technology is great because it helps us plan with pinpoint accuracy how things are going to go. It makes things a lot more efficient, so your time in the office is minimized. It helps things be a lot more planned out, so we can be specific on where things are going to go, where previously we would have to kind of guess and just use our hand skills. Now we're able to use our mind with our hands and plan things from the get-go, so we have that end goal in mind.